This is my 5th night working here, bro. And my 5th night, I've been down here in the ER. See what's going on? Respiratory therapy, how can I help you? Nah, is it still going off? You know what it is, bro? They gotta change the room. It's the airport that's in the room. It's not sticking, the yellow tubing is not sticking to the inside of the wall, so it's coming out, so it's going back to 100%. The medical air isn't blending it. And I tried to like rig it up so it could like stay there and it won't tug out. Yeah, but so you gotta kind of like just rig it up a little bit or change the room. If you don't do that, it's gonna just keep going off. And I can't put her at 100 because she don't need 100 though, you feel me? If I put her at 100, it just stop going off because it'll be at 100. But you just gotta yeah. So what you gotta do is just push that yellow piece back in the wall, and that should kind of like it fix it for a while. But we gotta just change the room. All right, then, man. Yeah. See, man, problems on top of problems, man. But I'll discuss that once I get into the call, man. What we represent, man?
Big money bound.
Say, let her know, man.
Big money bound.
The kids, man. You got the kids, man. Big Money Bound TV, RRT Posse, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all of the support. Thank you. Got a frog in my throat, man. So I come into work, man. I see they got me working in the ER again. Now, y'all know this like my 4th or 5th car talk. I done been in the ER. So I'm like, hey, man. Hey. What's going on now? We got to figure this out now. Come on now. I can work everywhere, bro. I want to be worked everywhere. I want to keep my skills up, bro. You feel me? Because when you only work in a certain area, you get used to that one certain area. Like, and especially at this hospital. In the ER, they have a certain documentation, like charting system, that's different from the rest of the floors. So once I get back to the floors, I'm going to be completely confused about which documentation style to even do. And then it's like, you don't get as many like nebulizer treatments, like you lose like your bedside manners. You don't get a lot of ventilator checks. A lot of like suctioning, a lot of like changing HMEs, changing ballasts, like all this stuff you may say, hey, come on, man. But that's part of your skills. That's part of like respiratory therapy. You want to keep those stuff like fresh and like up with the times, man. You just want to get used to like helping assist with intubation, putting a patient on a vent, doing one vent check, and by the time it's time for the second vent check, you already transferring the patient. You don't want to be doing that, you feel me? And then, speaking of transferring the patient, we had a patient came in that required at first the doctor wanted to get an ABG. I'm like, all right, do the ABG. It's uncompensated metabolic acidosis. PCO2 is 36. All right. PaO2 is like 100. All right. Patient needs some bicarb. Bicarb was like 17, 16. All right. So, get a bicarb. They calling me. Patient need BiPAP. I'm like, I just left the room. Patient was doing okay. The ABG showed it wasn't respiratory related. Why would you need BiPAP? Or the patient sweating. You need BiPAP because the patient's sweating? Like, but they mean like diaphoretic, like the labored breathing is not causing the patient like sweat. He's overworked. But that's a different description than just saying sweating. Shit, sweating is, I'm sweating. You feel me? Like that's how you gotta be up on your medical terms. So they're like, no, like he's having a hard time breathing. Oh, okay. I'll be on the way. When you say that, that's different from like you need to cause he's sweating. Like I'm trying to get as much information as I can from you while we on the phone. Bring a BiPAP, okay? Let me know why. Cause I need to bring the BiPAP and my intubation equipment Because this BiPAP may not work from what you're telling me. You feel me? So that's what I'm trying to get a good picture. So I don't want to come in there, damn, we finished it. I got to run back and get other stuff. I want to be prepared for whatever we need right then and there. You feel me? So I get in there, put the patient on BiPAP. Excuse me, dog. I just did 12 hours, man. I just did a 12 piece. Put the patient on BiPAP. Patient turned back around like instantly, man. They turned back around, no problem. So it's time to transfer the patient up. They're like, all right, how you want to transport? I'm like, all right, I'm going to just put the patient on a non-rebreather, and I'm going to push the BiPAP behind him, and then once we get up to the room, I'm going to hook the patient back up to the BiPAP. But then as I got close to the room, I'm like, you know what? Nah, that's not a good idea, because when this guy was off the BiPAP, the patient was breathing like extremely like fast, tachypnic, tachycardia. Worker breathing was like crazy, labored breathing, accessory muscle breathing. I ain't taking this BiPAP off. Dog doing good, I'm gonna keep him doing good. So had to transport with the BiPAP still hooked up to the patient with the stretcher. Man, it's not easy, but it's doable. You feel me? It's done. This is what we do. It can be done, but it's not an easy task. But if it's what the patient needs, it's what the patient needs. So that's how we had to transfer. It was a little bumps along the way. We had to like move some things. Oh my, you hit the heel of my leg and all that. You hit the heel of my foot. But hey, we trying to get everything done. But that worked out smoothly. Patient's doing good now. And like, we having like a mass exodus. Like, it seems like a lot of people are leaving the hospital. A lot of therapists, a lot of nurses, a lot of administrative people. Just a lot of people just leaving. So they're trying to let me know, like, hey man, I just want to let you know, dog, you're gonna be worked around to like multiple areas. You feel me? So I just want you to know, like, just be prepared. We see you as a strong therapist. I'm like, hey man, hey dog, all that's cool, man. See me as what you want to see me as. As long as I see my paycheck going up and up, dog. As long as I see an increase on my check, I ain't tripping about nothing, dog. As long as I see an increase on my check, hey, bro, do whatever, man. Y'all figure it out, dog. I'm doing more. I'm finna get paid more. That's just straight up with me, man. That's how I'm rocking. Straight up. And then it's like, with the COVID situation, man. We ordering treatments for patients. That's cool. I don't mind giving treatments to patients. I'm a respiratory therapist, bro. I give treatments. That's part of my job. But when it's a COVID positive patient and we have protocols in place that say you don't get those breathing treatments, I don't give them. So when someone calls and says, okay, we need a breathing treatment in room 69D, and I ask, is the patient COVID positive? Did we do the test results yet? Did we do the test yet? No, we didn't do it. Well, you may want to get on that, though. I can't do nothing until it's negative. Can't do it. It's just a for sure negative. They call me. Yeah, we got a new patient. Need a breathing treatment. All right, don't mind. What's the COVID status? They all say, she was negative yesterday. She was negative yesterday. Is this a new admit today? Yeah, they got readmitted. Hey man, need a COVID test though. Hey man, in them hours, I don't know what you could have did. Hey, we need RRT posse. Please drop down in the comments. Patient was negative yesterday. They get readmitted, they come in today. New admission. Are you giving that breathing treatment without a COVID status? A COVID update? I'm asking. Please let me know. Let me know how y'all feel. Please let me know. I want to know, am I on the right track or am I not? So am I doing the right thing by saying we need to make sure by getting the test? Or should I have given it knowing that it was just negative? Please let me know. Because I don't know. You feel me? I don't know. Speaking of not knowing, man, being like the unknown, I've been getting like a lot of like DMs, a lot of comments, even FaceTime one person with like the problem of not being able to pass your state board exam. And I know it can be like very frustrating for you after you done took these 2 years in this program, graduated, and you're having a hard time getting your license. I know this because I failed. You feel me? I failed that test too. But I didn't quit. I ain't give up. You feel me? If it's something that you want, if you want it, you feel me? If it's something that you want, you're gonna get it. Because you want it. You're gonna do everything in your power to get it. So whatever you gotta do, you're gonna do. It just hasn't happened yet. Don't give up. Keep studying, keep working hard. Use Kettering. Kettering. That's what I'm using. Keep using it. I do it once a week. Do it 6 times a week. I do it for 5 hours a day. Do it for 10 hours a day. If you want it, you're going to get it. Like I say, man, I know somebody who took 2 years and 10 months to pass that test. And they give you, you got 3 years to take it. You got 3 years to get, 3 years to pass it. Or you got to go back into their program. 3 years. And they took 2 years and 10 months. They kept going. And when we took the test, it was a little different because, like, you could do a retake after 24 hours. Now they got rules in place where you got to, like, wait a month or 2 months. You can take it in 3 months. You got to wait 6 months, 4 months. That's ridiculous, dog. Let me in here to take my test, man. Hey, wait 4, 5, 6 months and all. Man, that's ridiculous. I don't agree with that, man, but hey, man, when you playing by their rules, you got to play by their rules. Speaking of their rules, man. Sometimes, bro, I don't follow orders, dog. Don't follow them. I do my own thing, dog. Do what I want to do. Damn the doctor's orders. Randy, what the hell are you talking about? Keep listening. Patient coming in, fire rescue. They saying put the patient on BiPAP stat. All right, that's cool. They also saying get a blood gas stat. Okay. You want me to put the patient on BiPAP, but you want me to get a blood gas before the BiPAP. But then I'm going to have to get one while the patient is on a BiPAP to see if the problem has been fixed. So I'm sticking the patient 2 times when they going on BiPAP anyways. Like I say, though, get an ABG, I got you, dog. Put the patient on the BiPAP. 10 to 15 minutes later, then I get an ABG. Everything is fine now because we're on the BiPAP. Like, I know it would be because I've been doing this for years now. And this is what I seen that order come across. ABG first. Get an ABG. It's horrible. Put them on BiPAP. Get another ABG. It's good. But it'll be on BiPAP. Of course it's gonna be bad. Somebody coming out labor, breathing, no oxygen, doing bad, need BiPAP. We know they need BiPAP. That's why you put in the order. Like, I don't need an ABG to say we need BiPAP, but I can see we need BiPAP. So, damn them orders. Do my own thing, dog. Do my own thing. Do my own thing, dog. Do my own thing, man. Let's say, when you part of this system in this program, man, sometimes you gotta just go with the flow and do things that you really doing that you don't really deem as necessary or like the proper way or just ethics. But you have to do it to keep your name off that radar, you feel me? Stay out of their line of fire. You get what I'm saying? Like, you don't want to put yourself in a position to get like, oh, well, he refused to do this, or they refused to do this, or they did it this way because now you're getting written up, now your name in HR, even though it's nothing but paperwork. But you just don't want a red flag on your name like that, you feel me? Here's an example. Let's say a patient COVID status is unknown. Doctor tell you, I want a breathing treatment on this patient. You reply back, we don't have the COVID status yet. The doctor replies back, this is a negative pressure room. Meaning, everything that's in the room stays in the room and doesn't go out into the hallway. So the treatment can be given. All right. I can get the treatment because it stays in the room. But there's currently people in this room doing stuff. Getting vitals, blood gases, assessments, interviewing the patient, all kind of stuff. Since you said go do that treatment right now, should I do that right now and let it just go on everybody? Since it's a negative pressure room? Of course not. But that's the order. But you gotta kind of, yeah, I'm gonna follow the orders. But I see the patient. No, you're not using accessory muscles. I'm still doing my assessment. 5-6 minutes won't hurt. So wait, that won't hurt nobody. So I let everybody do what they gotta do. Then you will go in there and do that. That's just a prime example. Like I say, man. Sometimes you gotta say down them orders and just do what you want to do, though. Hey, that's from Big Money Bound TV himself, man. So my last thing, that phone call I had answered. The situation was, it was a BiPAP being used. A ventilator was being used as a BiPAP, and with that, you gotta use the oxygen port and the medical air port to like blend the oxygen. Oxygen by itself is 100%. It's gonna be at 100 when using the vent. The medical air dilutes it and balances it out to go to 40, 50, 60, 70, 80, 90. That's how you titrate it because of this medical air. So the patient is on a FiO2 of 60. But the medical air is slipping out of that port and no medical air is coming through the vent. So it's just standing on 100%. So there's a way it has to be pushed into the wall and like wrapped around so it doesn't there's no tension pulling it. You do that, it works. And that's what I was trying to explain to the nurse. You gotta kind of finesse it a little bit. Or you guys just if you don't want to do that, you gotta just change the room so this error doesn't occur. Because it's just the port, it's the wall port. You can make it work. I made it work, but you gotta it has to be finessed. That's not a good thing to be doing, but you gotta work with what you got. You feel me? She say, oh no, yeah, I gotta finesse it so I can't put you on BiPAP, dog. Good luck. Nah, you can't do that, bro. You feel me? You gotta do what you gotta do until the situation is fixed. You feel me? By a work order or something. And that's just my scenarios for y'all, dog. Like I say, man. Big Money Bound TV. I appreciate all the support. Thanks for watching. Car Talk number 95, 90. Just a heads up, man. Car Talk 100 is gonna be my last one. Car Talk 100 is the last Car Talk. Unless y'all say otherwise. Now, if I don't see nobody saying otherwise, Car Talk 100 gonna be it for me, dog. Straight up. But right now, this is it for me. Y'all stay safe. Let me put on my seatbelt first, so y'all don't give me no trouble. All right, I'm out of here, thug. Lights out.